Live.
Okay, I'm not seeing it.
It's coming up.
We had this issue before.
Hey, my man.
Technology.
Ah, there we go. Oh,
Okay.
that's dope. There it is. Everybody's here. All right, let me share it to my page. All right, and share it to the page. All right. All right, we'll go ahead and get started.
Make sure everybody's muted on your end. Not everybody's muted.
Not everybody's muted. Did you give it back? I think you have it.
No, everybody's not muted. So just make sure they're all muted, and then that way we can start.
Don't you have the power to do it?
Oh, forgot.
You're the host. The host.
All right.
All right. First off, I'd like to thank everybody who dialed in, signed in on Zoom, and whoever gets to watch this on as we stream. This is our first Speak Up and Be Heard. I'm super excited. This is something we've been talking about for a while. This is our first virtual Zoom live stream as well. So I know a lot of us are technically, yeah, whatever. Y'all know what I mean. Challenged with the technology. So I'm obviously verbally challenged right now, but this situation is allowing us to kind of spread our wings and force us in a situation where we are going to be using different ways to communicate. So I'm actually pretty excited about using this technology and hopefully being able to reach larger audiences. Well, first, let me thank everyone for signing in, but special thanks to our speakers. Hopefully we'll get Dr. Smith to sign in. We have Commissioner Colvin in here. I think Commissioner O'Connor will be signing in, unless he sent you in his place, Colvin. And Dr. Brewster from the Health Department is on, and we have Lieutenant Steve Simmons from the Sheriff Department. And we have a ton of other important people in that signed in. We have a visitor from Charles County, Dialed Sweat. Thank you, Madam President, for coming through. We have a representative from Brian's office, the superhuman Wren. Of course, we have Dr. Walthour on the line, our foundation for the 7025. And you've all seen Adrian, and she's pretty much at the steering wheel at the moment. The intent of the Speak Up and Be Heard, the commissioners have a quarterly public forum. Dr. Walthour, she would get a lot of members of the executive committee to go and speak up. We had small groups of like 3 to 10 people that would come up and speak, especially around budget time. And we felt like we didn't necessarily have all the input from the community that we needed. We wanted to make more of an effort to be proactive, to go out and get the input from the community so we can make sure that what we deliver to the commissioners at a public forum was truly represented what the need of the community was. So we can truly be the voice of the St. Mary's County. In an effort to do that, what we wanted to do is make sure that we spoke to the community and let them know some of the issues that we saw, and hopefully we can get some subject matter experts so we could be a little more informed on some of the issues of the day. This upcoming one, the 21st of April, is going to be focused on budget. We are some of the subject matter experts that we have on the speakers today. So Dr. Brewster, Lieutenant Simmons, of course, they're not tied to the budget, but this is a unique situation where I think almost every opportunity we get to speak to a group, we need some better understanding of the situation as it pertains to COVID. So having Dr. Brewster and a representative from the Sheriff Department, Lieutenant Simmons, I think that's important to have those for this situation. But this will not be just one event. This will at least be quarterly. So these will be partnered with all of the quarterly public forums. So we have another one on July 14th, another public forum scheduled on the 20th of October. Those are the commissioner dates, and we'll back those dates off about a week. So this week, on the 21st of April at 6:30, I believe we'll have an opportunity to call in. Am I right on that, Commissioner Kovat? You can nod. Or you can jump. You can answer.
Can you hear me, BJ?
Yes, sir.
Okay. First off, I just want to say thank you for doing this. This is an absolute wonderful thing. But you're 100% correct. We have that, but we also have a public forum hearing that morning at 9:15 that you can also call in. We are allocating $3 million of Commissioner Reserve money in order to help with the coronavirus pandemic that we're dealing with. So we will take public comment for that at 9:15 in the morning also.
Okay. Thank you, sir. And thanks for showing up. Love that beard, man. It's fierce. All right. Yeah, so we'll be calling in at 6:30 to address some of the issues tied to the budget. And hopefully we can capture some of the comments from tonight when we represent our organization. Just so you understand how this will work, I'm doing a longer than expected intro. Then we're going to go into, we want to if Dr. Smith is on, want to go to Dr. Smith or the representative from the Board of Ed. And then we'll go to Commissioner O'Connor. Then we'll go into Dr. Brewster, where she'll get into the COVID piece. And then we'll finish off with Lieutenant Simmons. The first two speakers will be touching on budget issues and issues that tie to the budget. And then we'll move into a more of a COVID focus once we get to Dr. Brewster and Lieutenant Simmons. The speakers will have 3 to 5 minutes, and all of our questions will be saved to the end. So if you have a question, you can do it one or two different ways. You can put your questions into the chat, or you can put your comments into the post on Facebook, since we finally got live. So we have people monitoring Facebook, and we have people monitoring the chat room, or we'll be able to open up. Is this one of those ones where you can raise your hand? I don't see that function. But the chat room will be open if you want to. If you're not from if you're on the phone. Yeah, Marsha Greenberg raised her hand. Thank you. If you're on the phone, we'll open up the lines and make sure that you have a moment on the back end for questions as well. Dr. Walthour, don't worry, we got you. We'll definitely open up so you can get a couple minutes in. All right. Quickly talking about the budget. This session, I didn't want to take up too much of the time talking about specifics on the budget, because budget conversation can be droning and not everybody's necessarily interested in it. But one of the biggest focuses one of the things I wanted to focus on was the Board of Elections drop-off locations. I'm not sure if you're familiar with the comprehensive plan for the primary election. The primary election has been delayed from April 28th to June the 2nd. And there has been language submitted to, well, that there was a plan that was put into to the governor, and he approved drop boxes at your early voting location, with some limited in-person voting on June 2nd. So the 12 days leading up to the primary election, you'll have an opportunity to drop off your sealed ballots, and you'll have in-person opportunity for in-person voting on June 2nd. The problem is the problem would be in our county is the location, I believe, will be the early voting location, which is in Hollywood. And we wanted to make sure that the people in Lexington Park, Great Mills, and below have a location that is a little more convenient. Wrote a letter to the Board of Elections requesting an additional location in the Lexington Park area. And we are waiting on a reply. So that'll be something that we bring up. I know there'll be a funding issue. I mean, well, finances are always mentioned when we talk about that. But I mean, even in this current situation, we need to make sure that we protect our rights to vote. COVID can't be an excuse to not make it convenient for people, convenient and safe for people to get out and exercise their right to vote. The community center, I think everybody is familiar with the community center YMCA effort that's going on right now. I understand that we're in a weird place now because we never did get to finish out what was going on with the YMCA Exploratory Committee. But I will be trying to. I would like for people to consider the fact that we are spending about $8 million on turf fields, in the current proposed budget, and we're not even taking a look at the. We don't even have money in there for the engineering. So if we actually have a recommendation ready from the exploratory committee, we still have to wait another year before we can get engineering started. So I'm like, if we can get $8 million for turf fields, we could cut off $500,000 for at least the engineering piece. That was what we also want to talk about, some of the education budget issues. But is Dr. Smith, did he sign in or call in?
You'll have to get someone to raise their hand and see. I have everybody muted. I don't know what numbers or which, so.
I think Dr. Walthauer has she spoke with him. So if you know her number, so just.
I have notes, BJ, if you need them.
Go ahead. You got the line. Dr. Walthauer?
You want me to go with my notes?
Yes,
now?
ma'am. Yes, ma'am. Open up.
Okay. All right. Of course, BJ. Hi, everybody. Thank you all for tuning in. And thank you, BJ and AJ and all these technology folks that know the technology. I'm still on my old phone dial. I don't want y'all to see me. Anyway, I did have some notes from watching the board meeting. They had a board meeting on Wednesdays, a Board of Education meeting, and I did watch that board meeting and took notes, and I also put a call into Dr. Smith. I don't know if you all know they have extended the school year just till May 15th again. The schools are closed until May 15th, and then they'll reassess. So he said he might have some things that he needs to do. They're trying to do a video and do some planning because they were trying to get information out to the students and parents about the governor's talk that he and the state superintendent. But in talking with him and listening to the video, they did have a total budget request of about 232.6, but that included all funding sources. The federal, state, all included. But they did request from the local government at the onset of the budget process 13.6 million, but they only got 109.9. So there was like a 3.6 million difference in what they requested. But they were also, in my words, allowed to use. They had a $2 million fund balance that they were able to use, and that was quite fortunate that is available to them, considering all that we're trying to do now. But this is for the 2021 budget. So Dr. Smith said that they would have enough to pay the teachers their salary increases, their steps and COLAs, but they do have a savings due to schools not being in session. So they had actually, with the original amount that they had asked for, they were planning to enhance staff. The BOE had planned to add some special education teachers and paraprofessionals to work at the elementary school level, especially with your young children, your 5-year-olds and your pre-K and first, second graders on issues, not only just instructional issues, but and concerns, but also some of the social emotional concerns that the kids have and that would need that support. They had a nurse in the budget. They had a pupil personnel worker in, IT coordinator, IT upgrades, and of course they were looking to have safety and security staff at the elementary levels, because that was one thing they reached out to parents, I guess, and parents were reaching in requesting more safety and security at the level. They've spent a lot of money on the high school levels. But as I said, their request for full funding was not supported. So that meant that those positions are not going to be filled. In particular, again, there's the special ed teachers and paras for the young children, and the safety and security. And so that is the area, and speaking with Dr. Smith, that he is, they need everyone, but especially when you tune into what's happening now, it will be, these will be things that they had tried to put in the budget, but they had to not submit because of the amount of money they were given to work with. So in light of the COVID-19, we, the NAACP, are proposing that we ask for full funding. This is what we're, as a committee and group, we are looking for, I guess, for any comments or concerns you might have, but we see the process being fully funded, the budget, and we do encourage the commissioners to work with the Board of Education to provide additional funds at this point, because they will need more portable laptops and more opportunities for the internet connections in their homes, for extended learning. I mean, if there is a wave of this virus, there is a concern. And I know if you listen to the board meeting, they only have 1,000 computers that they can use that they can free up I think the enterprise reported it wrong. The enterprise reported 9,000, but superintendent said no, that was 9,000 in the schools. You know, the standalones, the laptops that they're using for school programs and the staff. So of the 1,000 computers that they are having to, you know, divvy it out. The staff, some of the staff members don't have computers or internet services. That was another issue. We don't have high-speed internet everywhere. In some places in the county, there's not even phone service. You can't get phone service. And of course, those kids that don't have that, they are providing home packets for them. But again, not having access to the computers and internet is an issue that's going now that they are working on. But they have a plan, and as I said, for the staff, and they're looking at the seniors having access, because they have to take, especially those seniors that are doing their getting college credits and advanced placement, they have to go online to take tests if they don't have access. So I guess the main question that they have asked is who has access to the computer, to internet, because that is something that will be ongoing as we try to wade through this crisis. So again, that's going to be needed for regular education enhancement, probably forever now. That's my take. DJ?
Yes, ma'am. Thank you,
Okay.
ma'am. That was pretty
Any
comprehensive.
questions? Okay.
Yeah. We'll get somebody to call for questions at the back end. So if we don't have
Okay.
a representative on by then, you'll be our subject matter expert for the since you're education chair. All right. Do we have O'Connor? Is that John's iPhone? Adrian,
Which one? I'm sorry.
John's iPhone?
Oh, I see it. John's iPhone. Here it is. He has to unmute himself.
Okay, maybe that's not him.
Yeah. All right.
Okay. All right. So, being that we do have another commissioner in the building, Commissioner Colvin.
Yeah, can you hear me, BJ?
Yeah. Just so you get an understanding of the intent. First, I want you to explain the budget process, because I think a lot of people don't understand what the process that you all go through of getting the budgets proposed from the different departments and the approval process, and if you could explain exactly where we are currently and
Okay.
what else has to happen before we actually have a budget in place.
Sure. No, that sounds good. Thank you for the opportunity. I haven't talked to John today, but I'm sure he probably got busy with something, but meant to call in. So real quick, before I get into the budget, I just want to follow up on Dr. Walthour, because she is basically a fortune teller, prophetess. At probably our last public hearing, she was, I believe, the last speaker to stand up. And her comments, the only time I've ever heard anyone say this, she said, we need to look more at getting broadband internet access to the far reaches of the county. And she was predicting the future right there. She was 100% correct. And that's definitely something my district, as southern part of the county, is greatly impacted by that. So I heard her, and I wish we could do more right now. We definitely need it more. But the budget process, it's a couple month long process where different county departments and the different elected official departments, such as the Board of Ed, the Sheriff's Office, they all bring their budget requests before the commissioners, and we develop a budget. And we're at the stage where a budget has been developed. and tentatively approved, and it goes before the public hearing so we can get comments from the public. So it's critically important that you all speak up and voice your opinions. There's a lot that's happened since the budget was approved with this virus, so it's probably going to change a little bit before its final approval. I'm not necessarily the best commissioner to defend the current budget. I would encourage everyone to go back and watch the very last commissioner's budget hearing. I voted no on bringing forward this budget. I did not like the way that it was done. The numbers that I remember, and I don't always get the numbers correct off the top of my head, I wasn't very prepared for this, but the numbers I remember from the Board of Ed was 7.5 million, I believe, that they were asking for above maintenance of effort. And what I was okay with doing was 5 million above maintenance of effort. And that would have been, I was in close contact with the Board of Education members and with Dr. Smith, and they would have been able to do a lot of what Dr. Walthour talked about in her notes. And what the commissioners agreed upon was about 3.7 million above maintenance of effort. And so that's what they have taken back and reworked the school budget in order to make that work. I believe that will stand. I do not believe that will get reduced any further, but there's still a lot of time before the final budget is passed. Oh, hold on, buddy. Sorry about that. My son's playing here. Yeah, so I'll try to answer any questions that anyone might have, but it's a long process to develop the budget, and there's a lot of needs in the county, and there's only so much money to go around. And I'm not trying to give an excuse or cop out of anything, but we're trying to do what's best for everyone. So thank you all so much for just even tuning in and taking an interest. That's really important.
Okay. We have another commissioner that popped up at the, I guess we can call this almost on time.
Yeah. Police time. That's it. We've been busy, real busy today, so that's it. But I went ahead and put myself out on in an area, so I'm good to go at this point.
Okay. Now we're looking at you. We've kind of covered the budget process. One of the things I wanted you to talk about was kind of spinning into the introducing us to the COVID conversation. Would be the conversation that was started online about the one-on-one services.
Right. Oh, great. Yeah, that's been 2 days. Well, the COVID-19 in itself. The effort by the government to start there has been monumental. There's been a ton of work that's going on behind the scenes, all the way from Annapolis down to St. Mary's County. The one-on-one finally today, after the conversation started early. Oh geez, I think it was 7:30 in the morning yesterday with the one-on-one barbershop and how that's going to work based on COVID-19-01. And yeah, there was a lot of back and forth. There was a lot of confusion. There was a lot of misinformation that was out there. So today, finally, I was able to get the full clarification and a statement from Director Shu, who is on the COVID task force, the executive director, and that's now been pushed to the law enforcement agencies. So with that being said, the barbershops now at their establishments, it's in writing and it's all been verified, are able to have persons come there. And DLLR, the licensing requirements essentially for people to go to their homes, go to have the barbers come to their homes, or for them to go to the barber's home has been waived. So now they're not going to get in trouble, and it's not illegal, and they're not going to lose their license if they do operate that way. So that's important, because I didn't want to have our citizens, our barbers, our salons, and those in that industry making themselves criminals by going to provide a haircut or a service to somebody under this executive order, because that's essentially what would have happened. Now with the salons, they have to follow the CDC guidelines. They have to wear protective gear. They have to wear masks. It is one-on-one by appointment only. And there are some caveats with that. They want you to be an essential person or what is defined, firefighters, law enforcement, those that may have their hair may interfere with their job function. If you're an equipment person and your hair would get in the way and you might have to be injured, they just don't want it for cosmetic purposes, and generally speaking. So that I was able to get that, but the cosmetic purposes was the hardest part. I just can't get over that portion of it. So medical reasons do qualify.
Oh, I'm sorry.
You're good.
I was about to mention the mental health aspect of the cosmetic portion.
Right.
But,
Yeah. We had the conversation, and I think that there's room there. They're focusing on the essential portion of it, and that comes into the travel when it comes down to the state. So
Gotcha.
if there's an essential reason behind it, then you're okay. I believe that was 2 days of lots of emails and frustrations, but I think we're there now.
Yeah, I saw a lot of people comment, "Who is John O'Connor?" It's like, yeah, people passed that email around, and they asked about a shoot. So it's like, why is this guy the one that's answering the email? So
Right. Yeah. Well, so Steve Shu, he is the executive director on the COVID-19 task force. He is the actual liaison between counties and municipal governments. So he is the person that me and as an elected official would go to. Then he would provide me with the answer. And they have a different person that liaisons with the law enforcement. So what really was happening is there was 2 messages that were out there. And now they all got together, DLLR, the licensing, Office of Legal Services, the Steve or Mr. Shu, excuse me, and came up. They put their heads together. They figured it out, and everybody's on the same sheet of music now. So that has been distributed to the St. Mary's County Sheriff's Office, and it is also at the Leonardtown Barrack for Maryland State Police. And of course, they did their due diligence and they verified it. And now they have all the verification in hand for those services. So when people are doing this, they should feel comfortable that they know they can be there at this point. And in fact, I will demonstrate that this weekend, and I will go get a haircut.
okay, roger that.
Yeah.
Appreciate your time, sir.
Definitely. Sorry I had to join you late. It's nature of the job up here. Is there anything else I can answer for you? I think
we're hitting questions after we hit the next two speakers. So
all right.
If you can go on mute for a second, we'll come back to you. Dr. Brewster, we're going to transition over to you, and since I think that was a good transition over to the COVID-19 situation, and if you can start by giving us some an update on some of the demographic information as far as St. Mary's County goes, and then if you want to talk state level, that'd be good as well. Just talk about some of the issues that we're facing here in our county.
Great. Well, thanks so much for having me on, and really appreciate everybody taking the time to gather virtually and talk about all these important topics. I know there's an incredible amount of stress in our community right now because of this pandemic, so really appreciate you all bringing in this topic to your meeting. The COVID-19 pandemic, as it's affecting us locally, right now we're sitting at 117 St. Mary's County residents who've been diagnosed through laboratory tests as having COVID-19. Unfortunately, we've lost 3 of our own residents to this disease thus far. And we do keep all the detailed data related to our local cases and counts and so forth on our own website of the St. Mary's County Health Department at www.smchd.org/coronavirus. So there's a lot of data there related to what we can share at the local level, what we have access to at the local level. I'm happy to go through some of that. If you had specific ones that you wanted me to go through, I can do that.
Hold on a second. I'm sorry.
All right.
You said demographics on the local level. Say that one more time. I'm sorry, if you can just
So
re-ask.
demographics at the local level, I mean, on our website, we describe the numbers of cases by age category. We break down the number of cases by certain race categories. We are also reporting out what zip codes have identified 8 or more cases in those zip codes. And, you know, we have it broken down by gender as well.
So it's only 8 or more on the zip code.
Yes. So when there's reporting of, so the map that you can see on our website has 2 colors, green or gray.
Right.
And if it's green, it'll say how many cases of COVID-19 and residents in this county have been associated with that zip code. If it's gray, it doesn't mean that there's no cases from that area. It just means that there's less than 8 cases in that zip code.
So can
and that's because of confidentiality reasons. So we have both national and state confidentiality laws to abide by. And we have to be really careful with sharing numbers where there may be a possibility of identifying people's identities. So that's why we do it that way. That's also similar to how the state of Maryland is reporting out zip code data as well.
Okay. Can you give us the race breakdown, the age
Sure.
breakdown, and I guess the top 3? I think there were only four zip codes that had over 4 or 5.
We have five now.
5. Okay.
5, yeah. So, you know, one of the things to consider in this is that this is all based upon laboratory tests. There are people that are sick with COVID-19 who are not getting tested. There are people who have symptoms that are similar to the symptoms of COVID-19, you know, cough, shortness of breath, fever, who may not be getting tested for COVID-19. So the numbers aren't necessarily reflective of everyone in the population that is sick from COVID-19 or has been sick from COVID-19. But it is an indicator that we're following. And certainly we are trying to make sure testing is more available to our residents. We've done a lot on that because we want, if people meet testing criteria or warrant testing, we definitely want them to be able to access testing. And so we can, one, both identify them, but then also do a process that we do, which is contact tracing and disease investigation. So by those tests, the positive laboratory tests, and that data, that breakdown by race. Right now we have it broken into African American or Caucasian, and then there's also another category of other or not identified. And unfortunately, the race identification or ethnic identification is based on these laboratory reports and records, medical records, that may not always have somebody's race ethnic identification noted. So we may ask that when we do our disease investigation contact tracing process, but some people may not be willing to share that or feel comfortable sharing that. So what we have so far in terms of what's identified is of the 117, 40 have identified as African American, 43 have identified as white, and then so far we have about 32, a little bit more than that, who are other or not identified. And those numbers get updated by noon on a daily basis. So we'll have further updates tomorrow at noon. The zip codes, you asked for the top zip codes. Again, these are just raw numbers. This isn't based on the population. Sometimes certain zip codes have more people living in them, and so you would expect to have higher numbers. But right now, just based on raw numbers, the most affected zip codes by people who've actually gotten tests and tested positive are 20653 and then 20659.
Do you know the areas? Do you know the areas tied to those?
Yeah, so I think that's the Lexington Park, Great Mills area, and there's Mechanicsville. We also have 20650, which is the Leonardtown area, and Charlotte Hall as well. I don't have the exact number for Charlotte Hall.
Okay. As far as the tests, how many people, well, people tested? How many people have actually been tested?
Yeah, so we've had over almost 1,000 tests documented. So about 820 negative test results. And like I said, the 117 that we have confirmed as positive.
Okay. There's been a lot of rumors going around about the procedure to get tested, what's needed to be tested here in the county. Can you
Sure.
clear that up for us as far as the health
Yeah,
department?
absolutely. Well, all somebody really needs to get tested is a doctor's order to get tested in terms of, what's required there. And then once there's a doctor's order, they can get tested, get the actual test through various means. So they could do the drive-through testing that we've set up alongside with MedStar St. Mary's Hospital. Right now, that's open from noon to 2, Monday through Friday. They can get tested in the emergency department, and most hospital emergency departments across the state are doing that. Definitely MedStar is as well. And there are some urgent care centers and primary care places that are also doing testing in their offices. So there are many more options for testing now in our county than there were, just a handful of weeks ago. I'm really, honestly, really, grateful for MedStar St. Mary's Hospital for moving forward with that drive-through testing mechanism. I think that really was one of the first of its kind in our region and really helped open up the door to, getting safely tested.
What if someone who has symptoms does not have a primary physician?
So great question. Thanks for bringing that up. We've actually, alongside with county government, established a COVID-19 hotline. And since we launched the drive-through testing mechanism, we really put out there that we want, if you have a personal medical provider, it is best to talk to that person, and because they know you best, they can understand what your medical history is, what other kinds of concerns they need to be concerned about with your health. So it's best to contact that person to talk about your risk for COVID-19, to talk about whether you should be tested, and then to get a test order if they think you need to be tested. If somebody doesn't have a personal doctor, then we actually set up the COVID-19 hotline to have a health department nurse. And then under my order as the physician health officer, the nurse can go through certain criteria, and if certain criteria are met, then can actually order the test under my name.
Okay.
Yeah.
I'm sure that other people will have questions. We'll
Sure.
open that up. Do you have
Sure.
anything else before we?
Sure. Well, the COVID-19 hotline, since you raised the topic, the number for that is 301-475-4911, and it's open from 8 a.m. to 5 p.m. Monday through Friday, and really is intended to answer questions people may have about COVID-19, about coronavirus, about other related type questions they may have. And also, of course, if somebody who doesn't have their own personal doctor wants to touch base with a health department nurse, we can answer those questions as well as best as we can. We do recommend that if somebody's having symptoms of COVID-19, and again, the symptoms are primarily cough, shortness of breath, and fever. There are other symptoms, but those are the kind of the top three we've been really focusing on. They should really consider what next steps to take. If they're having any shortness of breath or trouble breathing, that's probably a reason for them to be evaluated in person versus just calling on the phone, just so we can make sure that their breathing doesn't get worse, and that somebody's taking a look at how they're able to get oxygen. If you want, I can talk a little bit about what we've been doing at the county level on the COVID-19 pandemic, or I can save that for later if you'd like.
No, go ahead.
Yeah, all right. So, just generally, obviously, this has been a really super intense preparedness and response effort on behalf of many, many, many partners and individual residents that have really done a tremendous job coming together and finding creative and, supportive ways of working together on this for our community. Just to try to categorize, I guess, some of our response. I'll say that the first has been really about communication. So communications across all of the partners that are at the table or involved somehow in addressing different aspects of this pandemic has been tremendous. And I really thank county government and the Department of Emergency Services because they're part of bringing all the partners together that support this response. And Jenna Guzman in our office, who is working with the communications individuals from many different agencies and partner organizations through a joint information command. And so they're all working together to make sure that messages are put out and we're able to get messages out to the community through different sectors of services. And so our communications, the hotline's been a big part of that. We're also putting out quite a bit of public messaging through our own, health department, county government, and other partner organization Facebook pages and Twitter and various means that way, as well as, of course, kind of public releases and media interviews and so forth. So that's been a big part, just making sure that people can get the information they need as best as we can get it to them and make sure that information is accurate and that it's answering the questions that people have. So that's really important, that big piece of communications. The other kind of big pieces of responding to a pandemic like this, so one is disease, being able to identify illness, being able to identify disease, and then being able to control it. And a lot of that involves testing, like we've talked about, but then also investigating. So when somebody is diagnosed with COVID-19, we have to go through a pretty extensive process of identifying who their contacts have been, who could have been exposed, and then reaching out to those contacts and workplaces and so forth, so that people can take the necessary actions to protect themselves, but then also not to transmit infection to other people. So that's kind of what we categorize underneath containment. We're containing infection in our community, and it's just a really important part of responding to a pandemic. It's kind of like when you see cases rising, you have to really be very, very thorough in your disease investigation to try to contain the spread of the infection. Another big focus area is to protect our vulnerable populations. We've been talking quite a bit about how, especially early on this pandemic, the information we had was that people who are 60 and over or people who have chronic medical conditions, they may be most at risk for severe disease. We're finding more and more that even younger people in their 40s and 50s especially may also have severe disease, but we still see the heaviest and most severe disease in people who are over 60 and or have chronic medical conditions. And so we've been doing a lot of work with specific vulnerable populations, like those that live in nursing homes. Of course, we're concerned about our residents who are homeless and the risks that they may have, as well as our residents that are in specific facilities where people are living in group settings, so group homes, the detention center, and other places where people are kind of congregating. We're also very concerned about our healthcare workers, our first responders, our law enforcement, because they're the ones on the front lines interacting with people and being exposed to illness, probably more so than others. They don't have the option of staying home sometimes. And so we really need to protect that workforce so that we can continue to respond to this pandemic. Some of the other things that we're focused on is preparing for a surge. And, as you've seen across the country, as this illness peaks and more cases happen, if all those cases are happening at the same time, it starts to overwhelm your healthcare resources, your hospitals and your kind of support services, your first responders, all of that. So that's kind of what's behind the flattening the curve concept, is that if you can space out those infections, then they're not all surging at the same time on the limited resources you might have. So we do some strategies to try to space out the infection. That's what social distancing is all about. That's what staying at home is all about, to try to limit and slow the spread of infection. But we also prepare for the worst, and we know that there may be a greater demand on our hospital system and all of our kind of resources and critical infrastructure in our community. So we prepare for that by thinking of, well, how can we expand capacity in the hospital? How can we offer, different sites where people can get care? How do we really get the resources and staffing on the ready? So if we do get to a point where we're starting to see our system become overwhelmed, we can deploy those additional resources and keep people safe and get them treated.
You
So I
recently,
think that's that in a big nutshell. So I'd be happy to answer questions later when you're ready to do that.
you recently, you put out an order that required us to wear masks.
Sure, yeah. And that was actually superseded by the governor's order on Wednesday.
Right.
So the idea behind that's really more about cloth face coverings. And so cloth face coverings, the most important reason why we recommend that is because we're finding more and more that people are transmitting the virus, people who are infected are transmitting the virus without knowing, because they may not have symptoms. So this is before they develop symptoms of the disease. They may actually be infectious, and they may actually be spreading virus to other people. And so the idea behind the cloth face coverings is that for people who, aren't having symptoms, like a strong cough or that kind of thing, they can at least cover their mouth and nose so that it's better than nothing, right? It's not the greatest. It's not stopping all transmission, but it is better than doing nothing. And it is helping to prevent that, what we call asymptomatic or transmission of the virus. So spread of the virus when people don't have symptoms. And so that actually is a statewide order. It goes into effect tomorrow morning at 7 o'clock. So any Marylanders that are utilizing retail locations in particular, or public transportation, need to be wearing some kind of cloth face covering. And that could be a bandana or a scarf. It doesn't have to be a fancy homemade sewn one. But certainly our community has been coming together to help people out and try to get some of these cloth face coverings out there with their neighbors.
I've heard some rumors about PPE availability in our hospitals and clinics. You comment on the availability of PPE in our area.
So far, we're doing well in terms of all of our first responder departments. They get checked on daily. The County Department of Emergency Services checks in with them, and all the departments, they have to turn in reports every day talking about how much PPE they have and whether they have enough supply. The hospital is stable on its PPE access. The long-term care facilities, we're working with them quite a bit as well through the health department. We're getting them PPE supply. We're also coordinating with our behavioral health providers and partners and group homes to try to get them PPE if they need it. So there's a lot. I mean, this is a big effort. I mean, there's a lot of effort to make sure that we can get PPE into the hands of the groups that really need it, especially our first responders and our healthcare workers and law enforcement. So we're doing a lot of work on that. We are recommending even now, because we know there's national shortages of PPE, because we haven't caught up nationally in the production of PPE that the nation needs, and certainly also here in Maryland. So because of that, and we know that, and we don't want to run into the horror stories where people have to provide care with no PPE. People are at this time talking about decontaminating their PPE properly so they can reuse it, or what we call extended use, where they can use the PPE, stretch out the use of the PPE. And so yes, those strategies are being used in some places because we know that we don't want to get into a situation where we've burned through all our PPE and we don't have any left. And we know there's more supply coming. We've put in requests for more supply. But again, we're trying to anticipate all challenges here and prepare for all of those challenges.
I'm sure that there will be questions for you, but thank you for the information. Lieutenant Simmons.
Hi, can you hear me? Good evening.
Yes, sir. Yes, sir.
All right.
We would like for you to address how the COVID environment has impacted us on the law enforcement side. So has it impacted you? Have you seen any increase of law enforcement need since we've been in this COVID environment?
I'd be happy to speak to that. For those of you that I haven't had the pleasure of meeting, just a quick introduction, Lieutenant Steve Simons. I'm with the St. Mary's County Sheriff's Office. I'm the Assistant Commander of the Special Operations Division, SOD, and the Homeland Security Officer for the agency, which is kind of how I became involved in the pandemic and the COVID-19 situation. And I've had these opportunities to speak to people in groups like yourselves, and we appreciate it. So I don't want to speak on behalf of any other agencies, despite the fact that our agency at the Sheriff's Office is experiencing a lot of the same type of obstacles as other agencies within the state, Maryland State Police, and even across the country. But I can give you a little bit of insight as to what's happening here in St. Mary's County. It definitely has impacted and changed our operations a little bit. And what I mean by that is, on one hand, it's business as usual because we still have to respond to calls for service. There's still reports to be taken. In the beginning of all this, we noticed an uptick in property crimes and domestic violence. More recently, peppered throughout is executive order violations. And that's aside from the regular calls for service. To alleviate some of that burden early on, we set up some online and started utilizing our telephone reporting system a little bit more to alleviate some of that burden. Fortunately, we allocated some resources like our school resource officers that obviously school is closed down. So we were able to take that personnel and put them out on the road to supplement patrol. And we've been doing a lot of stuff with the Board of Education, the Health Department. For example, like the lunch distributions that the Board of Ed does, we provide presence and security for that. Fortunately, there hadn't been any problems, but just to create that presence and familiarity from a lot of the students that are used to seeing the school resource officers in the schools themselves. We've been assisting with the drive-through testing at the hospital as well. And recently, I'd say maybe the last week or so, we've been trying to assist a little bit more the health department with visiting some of the retail establishments and businesses and focusing on the education component. So we're not there to lock anybody up. It's just to help get the word out, make sure that everybody's on the same page. We're all residents here, and we care about the community and about our health and our families' health and our friends and neighbors. So we're all working together through this. And obviously, we're taking precautions. Our PPE, as you mentioned, we've increased the use of that in the field. We're at the point where essentially any contact that we have with the public, we're utilizing those masks, N95 masks. That's general contact. Of course, if we go into a situation where we know it's a hazardous environment, then we may utilize more to include gloves or even suits for that matter. Fortunately, we've been very fortunate with not having a ton of those types of situations. We're just more precautionary type of situations, but definitely taking an impact, definitely changing, how business is done all across the county, not just us. I see a lot of telework happening and flexing hours and just really trying to minimize that social distancing within the work environment. And based on my observations, I think it's being very helpful.
Roger that. Thank you for your input there, sir. We'll try to open it up, see if anyone has any questions for you on the back end.
Yes, sir. Thank you.
Yes, sir. Before we open it up for questioning, I forgot that we probably should have a conversation about business resources. And I know that a lot of people have been in need of some support, especially the small business owners. We have our acting regional director, soon to be
That is correct.
regional director of the SBDC for Southern Maryland. So Wynn Briscoe, can you help us out with the resources available here for small business? Well, for businesses.
Yes, can you hear me clearly?
Yes, ma'am.
Very good. Thank you all for joining tonight with the 7025. Again, I'm Wynn Briscoe. I'm the Economic Development Committee Chair for the NAACP St. Mary's County branch, and I'm the Acting Director for the Small Business Development Center. So I wanted to go over the businesses as far as the resources that are currently available. As many of you who may be in business or may be entrepreneurs and may be struggling during this time, please do reach out to our Small Business Development Center. If you do not have that information, we'll make sure we post it, but the best resource is going to be sbdchelp.com. It's going to be the quickest way to reach any of us. And also the information that was out 2 weeks ago that we did a video on, a lot of those resources as of now have been expired or exhausted. So we want to make sure that you are aware of what's current. The Small Business Administration at this time, when it comes to their economic industry disaster loan, that has been exhausted as far as funds for this particular time, as well as the Paycheck Protection Program, some are referring to as PPP, that has also been exhausted, both as of this week. The Maryland State Commerce had a grant and a loan relief program. Both of those are exhausted at this time. I'm not sure if they will be additional funds will come, but do keep up on those two. Again, keeping up on our social media with Small Business Development Center. It's going to be the Maryland Small Business Development Center Southern Regions page on Facebook. We are posting very actively to keep up with these programs. They are changing daily. So it's something that minute by minute we're trying to stay on top of. The best thing if you are a business owner or an entrepreneur would be to visit a website that's called reliefwizard.net. And that is going to take you through a step-by-step questionnaire for you to be able to assess what resources are available for you in your current business or entrepreneurship. If you're a solo entrepreneur, it'll let you know what is currently available, what unemployment options are available if you're a business owner, things of that nature. It's going to ask you those questions. So again, that's www.reliefwizard.net. And visit that website. It's very helpful. For those who are seeking unemployment, under the CARES Act, there was unemployment for self-employed, what they consider those independent contractors that typically would not be eligible for unemployment. So you want to visit the Maryland's website for that. Department of Labor and Licensing, DLLR, has the information there on unemployment for the self-employed. As well as if you are a traditional W-2 employee, your standard unemployment information is there as well. Keep up with our 7025 YouTube. We also did 4 videos I did in the last 30 days, and the information of resources for small businesses.
Oh.
Hear me?
Yeah.
I think it dropped.
Yeah.
Is that better?
Down goes Briscoe. You good?
Okay, I'm sorry. I think that was an interruption in the internet. But So you want to visit the YouTube channel for the 7025 that has those videos there, resources for small businesses, giving you a listing of A to Z for what resources are current, updates for unemployment, and then also for our nonprofit community. We do get questions a lot for those nonprofit organizations, churches, and community organizations. So there is a video there with a link to the College of Southern Maryland's Nonprofit Institute. If you all are not familiar with that, it's a free resource. If you are a nonprofit in Southern Maryland, and they have consultants to assist those nonprofit organizations with funding that is available for nonprofits. So we want you to keep up with our social media and visit those websites, because this is going to be something that's going to impact these businesses for months to come. You know, there may not be what we're looking at for another 1.5 to 2 years before most businesses are really back on their feet, back financially, post 2019 cash flow. So it's going to be a long haul. If you are a business owner and you need assistance, please reach out to us. Also, we had spoken about budget assistance, and that'll be something that BJ will put out in the 7025 team. If you are in financial assistance needed, we can help you with understanding how to craft a budget, understanding that the stimulus checks have mostly come out now. If you haven't received it, you want to reach out to the IRS if you feel that you are due and you haven't received your $1,200 check. Please do let them know immediately. But we want you to obviously make the best use possible of whatever funds that you do receive, especially if you're on unemployment. It's not about how much you make, it's about how you spend it. So from economic development, we want to make sure that we can help you with any of those budgeting concerns that you may have as well.
Thank
And
you,
I can
ma'am.
wait for the questions at the end if anyone has any specific questions regarding business or nonprofits.
Yeah, I'm excited about your economic survival summit.
Stay tuned.
Yeah, stay tuned. All right. I am going to now open it up to Adrian. Adrian, do you have the questions? Any questions? Anybody submitting any questions online?
So we're going to do this a couple different ways. I am actually monitoring the Facebook page, and just anybody who has questions online, go ahead and give those to me. If you're on the Zoom call currently, please address your questions in the chat room. Yeah, and so we'll do
Hey,
it.
before we go too deep, I want to know what this great slogan is. What is this great slogan for the electronic signage?
Questions at the end if anyone has
Simons,
questions.
Lieutenant Simons.
Business or nonprofit.
Yes, sir.
Somebody said you had a good slogan for electronic signage.
So I can't take credit for it. I give credit where credit's due. This came from Captain Hall. And our last meeting, we were trying to think of what to change our board to, because I think you lose people's interest when it's the same thing. So he said, I got one. How about maintain a safe space and cover your face? It's short, it's sweet, it's direct. Dr. Brewster gave it the thumbs up, so we let it roll.
I can't take credit for it.
Say
I
that
give
one more
credit where
time.
credit's due. This came from Captain Hall.
Okay. You said maintain.
Yeah, maintain a safe space and cover your face.
Boom.
So it's to the point. It gets the job done, and it's easy to remember. So thanks, Captain Hall, on that one.
Boom. My brother from another mother. Okay. All right. Adrian, do you have any questions?
Trying to think of what
I
to
am
change our board to,
actually
because
still
I
looking
think
for
it
questions, but I have a
it's the same
question
thing. So
for
he said, I got one.
is it Officer Simons? Tell me the
Lieutenant Simons?
Lieutenant. I'm
Lieutenant
sorry,
Simons.
Lieutenant Simons. Do you happen to have any information on the detention center and any COVID preparedness for the detention center in our county?
Yeah, so I'm not housed out of the detention center. However, I can tell you that early on, contingencies were made as far as proper areas. If in fact it came to a quarantine situation, we have face coverings that are being provided to the residents there, as well as staff. So everybody has some type of face covering. Everybody's taking it seriously, and even the cleaning. I mean, everything is a clean facility. However, I mean, it's going up to the next level. So, knock on wood, we're good right now. And we hope it stays that way. But absolutely, a lot of planning and contingencies have gone into planning for that.
Okay, thank you for that. I do have a question. And actually, this is for Lieutenant Simons and for Commissioners O'Connor and Colvin and Dr. Brewster. So let me see if I can get make sure we're all on. But the question is, could you comment on your feelings about the individuals in Maryland who are protecting the stay-at-home order?
Protesting.
I'm sorry, protesting. Sorry, need to read that right. Protesting the stay-at-home order. Thank you.
I guess I'll go first. So this is a personal opinion. This is my own personal opinion. I think there reaches a point, you know, I have younger children and I have a teenager, and I've had many discussions with them. Hey, what's the problem? I'm young, I'm healthy. What are the odds that, you know, I'm not going to die from this? And I think it's easy to lose sight that everybody is doing their part. So even if you are young and you're healthy and you're pretty confident that it's not going to hurt you, it's a community effort. You know, most people have family at home. They got grandparents, they got people in their homes with weakened immune systems. So it's not all about me or about this person. It is about our entire community. And if everybody doesn't do their part, it's not going to work as well. So while I support anybody's rights to protest whatever is important to them, I would just encourage them, before you walk out and stand up on that soapbox, to do your own research and not just jump on the bandwagon. And I feel confident if people that want to protest to do their own research and a little bit of homework, I think they'll come over to the other side and understand the importance of it.
Yeah, I just want to add on to that. Thank you for going first, because he absolutely nailed that answer. But that's exactly it. We're all in this together. We're all working in this together. It's a community effort. And I've been watching as our emergency operations center meets since the beginning of this crisis. And everybody is just nailing this and knocking it out of the park. And Dr. Brewster is an exceptional leader for our county. She's very data-based in all of the decisions that she makes. And that's what it all comes down to. The data is driving the decisions, and we're doing this to help keep everyone safe. That's why I'm at home. That's why everyone else is at home. I understand the frustration, but we just need to stick together with this and get through it.
All right, I guess I'll go now. I got my mask on because I'm going in and out of the store, making sure people have their masks on. So that's where I'm at now. So I guess that leads to the protest portion, right? You know, ultimately, I feel people's frustrations. I do, because, you know, I get frustrated myself. I'm sitting there and I'm at work. I go home. I go to work. I come home, and that's it. So I understand that. And then I've asked people to tell me what rights do you think are being violated right now? And unfortunately, nobody's been able to answer that. My feelings on the protest is, really, you're putting more people at risk because of your frustration when you're going up to Annapolis. So you have the first responders that have to be out there. You have all the legislative personnel that are up there. You have citizens that are going to be out doing their essential tasks. at the same time. Is it necessary to protest this now, knowing it's not going to change? There may be another way to do it. I understand the frustration, though. I understand people want to have their voices heard. And regardless of what the situation is, it's in our nature as Americans to speak up and protest. And when you have a government that's doing and taking the measures that they're taking right now, that is unnatural. It is not what we are used to in this day and age. And you're gonna get that pushback. And some people are on that fringe, that step that's out there that says, no, this I've had enough. Enough is enough. And you see it in various different groups, even within the Second Amendment groups. You have the group that's like, okay, I'll take the moderate step, and then you have the other groups that go further. So ultimately, I don't think that they should go up there and protest. I really don't. I think it's going to put more people at risk. I think that there's other ways to handle it, and there's other way to get your message across. And the governor said it today, in his press conference. So my personal feeling is it's not necessary. We're doing everything we can to get to where we need to be in a fast rate, but I understand the frustration level. That's pretty much it. I think that there's
Thank
ways
you.
to handle it, and there's
Dr.
other way to
Brewster?
get your message across.
Sure. So thank you very much, and for everyone who's spoken already, because I think they've said all the thoughts that probably I would share as well. And Commissioner Colvin, thank you very much for your support in talking about the local response and the need to rely upon data. I think what we we're an amazing country that has always respected people's freedom of expression in many ways, and that is a really important part of our country. We are in a pandemic unlike anything that has been seen before, and we're in a pandemic at a time in our country where people are very used to being very mobile. Whether it's jumping in a car or going on mass transit or jumping on a plane. This is this isn't the time where we had pandemic flu where people were traveling around by wagons and bicycles and maybe a car. This is really tough on people. This restricting movement is really tough on people. So I can totally understand the frustration that's there. And when you're combining that with having a full household because you've got kids home from school and people not working, and you have the stress of the economic stress that this whole thing has been generating, it's a lot of stress. It's a lot of frustration that builds up. But we have to stay the course and understand the reason for why we're doing all these things. And the reason we're doing all these things is to save lives, because we're trying to protect not just ourselves, but we're trying to protect our neighbors and the people we love and our whole community. And we're trying to protect us from worse economic stress down the road when we start seeing even more disease spread or even more burden on our healthcare system or fatalities related to disease. And so there's reason for what we're doing. There's evidence already to suggest that it's working. It is slowing the increase. We're still increasing in our cases, but it is suggesting that we're seeing some effective social distancing because of stay at home, and that's decreasing the spread. We just need to recognize again that what we're doing, our personal actions are beyond our own individual selves. They are truly having impact on the health of our whole community and everyone around us. So I just want to say thank you to everyone who is putting up with this, really, because I know it's really hard. But your individual action is what's making this community safer and is protecting your neighbors and your loved ones. I think because the stress is so great and there's a lot of anxiety and it's really hard on people and families, I do want to mention that we have recently, just today or yesterday, and again, thank you to Jenna Guzman and a bunch of other people that worked on this, put out a behavioral health telehealth resource guide. And I think That is a great resource. It's on our website, smchd.org/coronavirus. And it also has been posted on our St. Mary's County Health Department Facebook pages. That's a really great resource for people to who are feeling a lot of stress or anxiety related to this, for them to look at some resources that they can use to help with that, and do so in a safe way through telehealth.
That's those are really great resources, and we'll make sure that we compile those and put them in our comments so that you all can. Have two questions again for Dr. Brewster. One is what is the anticipated surge for St. Mary's County?
Yeah, and that goes back to, great question. That goes back to what I was talking about earlier, is that we are right now, we're preparing for, what we predict or what we could potentially see in this community, especially if we don't see as much of a decrease in the spread of infection. So for Southern Maryland, basically how we look at surge is what we do is we follow a variety of different models. So there's all these different universities and mathematical experts, people a lot smarter than me, that make these projections or models. They're not even predictors, they're more like models. And they kind of are, if this was to happen and that was to happen, this is what you might want to expect. But these models, and there's several of them, change every day. And a lot of that changes because they're also considering how well people are social distancing, how well people are staying at home. Are they getting together over Easter weekend? And now all of a sudden we see a surge in new cases because of that context. So all of these things are considered in some of these models. These models tend to work best at the national and state level. They're not really great locally. And so it is a challenge for us locally because we don't have a lot of great predictors or reliable predictors of, how bad our hospitalizations will get or how bad the numbers of infection will get. So we really look at those kind of the state models, and we try to bring them down to the local level. And that's why we follow data on a daily basis, and we follow and run some of these models on a daily basis for our community. Right now, what we're expecting is that the peak, if you continued with the similar conditions that we have right now, that the peak on our healthcare system resources might happen in that mid-May to even early June period of time. We're still on the rise up in terms of the new cases that we've been getting. We expect to continue to increase in the numbers of new cases we've been getting. But I'll tell you, this social distancing and staying at home and all the efforts that everybody in our community has been putting forward to keep space, it's tremendous. It is making a really big difference. We see that every day at the health department because we have tons of people who have been repurposed to this pandemic that are working this and breathing this and working hours and hours every day, every weekend to do disease investigation and contact tracing. So we are seeing a difference because people are, making that decision to stay home and stay, far apart.
Okay, thank you for that. And I do have one more question, and it is specifically about the zip code 20653. There are some homeless or lower income people who have pre-existing conditions. Have there been any specific provisions to assist or provide protection for these particular citizens?
Sorry, is that question for me?
Yes, I'm sorry. It is for you, Dr. Brewster.
Okay, all right. So the question, just so I can capture it right, is a question specifically about individuals who are homeless and how those individuals are, what we're doing related to them. Did I get that right?
Yes, homeless, lower income who have pre-existing conditions.
Yeah. Okay, great. Thank you. Well, I mean, just to talk about the what we were just talking about, I think definitely applies to this question. Why it's so important that everyone is taking the measures they can to stay at home and avoid close contact with others, unless, of course, they're emergency or essential personnel. The reason why that's so important is because it's helping us to protect the people who may be more vulnerable. So the ones that you just mentioned that have more chronic diseases, or maybe are older, or don't have a home and maybe have to live in a space where they're closer to other people. And so that, those are the populations that have a harder time in dealing with this illness. And that's why it's even more important that the rest of the community and everybody else is taking those actions to also not just protect themselves, but also to protect all of these vulnerable populations. We do have a variety of partners working together in our community, including the Department of Social Services and Three Oaks and the Mission and the Sheriff's Office and many others, the Health Department, et cetera, working together very closely on how do we best protect and monitor for illness the individuals who are homeless in our community. Obviously, like I said, that's a really vulnerable population. They may not have access to medical attention and get tested and get treatment, or be able to raise the concerns that they may have about this, or even get the information we're trying to get out to the whole community. So we do have to have special strategies in place to, one, try to tend to and predict what their needs might be, but then also to make sure that they get the other kind of resources that they need so that they can live safely through this pandemic.
Okay, thank you so much, Dr. Brewster. These next few questions looks like they're going to go to Wynn Briscoe. So let me go ahead and pull Wynn back up here. So the first question is, the economic summit, will this be for Southern Maryland region? Let me see if you can unmute you here. Oops. I think you have to unmute yourself. There you go.
There you go. Can you hear me?
Yes, yes.
Okay, very good. Yes, the economic summit, that was BJ's idea. So I will ask him, is that for this region, or is that for including abroad for the North?
Man, no pressure. It's always open to our brothers and sisters from our neighboring counties. So I always preach the spirit of the Tri-County area. So
there you go. Yeah, we welcome all. Whoever needs the assistance and wants to be on and ask those questions, we want them to get their answers.
And when is the assistance that's available usable to start a new business, or just for an existing business?
So the assistance that I was referring to, that the funding has exhausted, that was COVID-19 related disaster assistance. So those things that I went over as far as the SBA and as far as the PPP and the Maryland Commerce programs, those were all relief programs for the virus businesses that were impacted and entrepreneurs that are impacted. As far as new businesses are concerned, there's still the existing funding sources are in place for new startup businesses. They are not, when people think about are there loans or grants for business starting, I'm very honest when I let people know you need to self-fund. There are no startup business loans if you don't have a very, very good business plan and a very good projection with a bank that you have some existing history with. They're still going to be looking at least 3 to 5 years of projections on how they're going to recoup any of their funds for that measure, and that would be a loan. So as far as grants are concerned, there are not. You would be self-funding. They look at grants for nonprofits and they look at loans for small businesses because, again, it takes money to make money. So.
Okay, very good. Thank you.
You're welcome. And this pandemic has let everyone kind of have the reminder. I work with businesses all over the state. We always encourage them, if they are going to start a business, we want to see 6 to 9 months of working capital cash flow in their reserves. For standard businesses, if there are restaurant or food service related, especially if they have a brick and mortar, we want to see at least 12 months of working capital reserves in their cash flow. So the businesses that are having tremendous time at this moment are those that do not have their working capital reserves saved. So it's key, if anyone is looking at starting a business, understand that if you went without income for a few months, are you able to sustain your business and your rent and your payroll, all of your expenses from your savings? If you're not, then you're not ready to start. You want to save some more.
Okay, thank you very much. I did have another question, and it might be for Dr. Brewster in terms of, and I'll unmute you here. The question was just about resources for, let me pull it up here. For masks, I think, and hold up, let me write. Here we go.
Understand that if you went without income,
it was.
Are you able to sustain your business and your
rent? I don't see it anymore. It was asking just about any guidelines for masks or resources for masks.
Yeah, I'd be happy to talk about that. Wonderful.
Good.
So what we're talking about is cloth face coverings, right? So cloth face coverings can be a bandana, it could be a scarf. And there's also guidance on how to make cloth face coverings without sewing, using a t-shirt or something you have at home. There's also guidance on how to make cloth face coverings with sewing and patterns and how you can do that. We have that all on our website. We have been posting this on social media on our St. Mary's County Health Department Facebook page as well. On our website, there's a great kind of handout that gives guidance on what to do and how to use it. People can Google it. There's lots of things out there as well. The CDC website has a bunch of information as well. But again, for those who want to go, our local website, St. Mary's County Health Department, has a lot of information on it, including a lot of what I've talked about today and all the data that we update every day. That website address is www.smchd, so that stands for St. Mary's County Health Department, smchd.org or org. And then once you're there, if you just go to the front page, there's a big red button on the front page that says, that's about COVID-19 or coronavirus. So click on that, it'll take you straight to our coronavirus webpage.
Okay, thank you for that. That's great information. All right, and we, that was all the questions, but we do have Commissioner Morgan that is on the line, and I'm going to unmute you, Commissioner Morgan. Where'd you go? There we go. And okay, I think you're unmuted now. Okay, all right.
Okay.
Okay.
All right. Did he want to talk?
That's it. I think that's it. Then we'll see if he chimes in. If not, I think that's it for questioning.
Did you open up the phones?
So we're gonna go ahead and I'll go ahead and open up the lines here for any specific questions. I'll go ahead and unmute you.
So if you're on the phone line and you want to speak, I'll unmute you from my system, and then you can unmute yourself. Or if anybody has any questions, they could raise their hand also, and then I'll unmute you as you raise your hand. That'd probably be the better way to go.
If there are none.
Yeah, I don't see any.
So this is a little bit under 4 hours. I know people were scared when they saw the 5 to 9. Wanted to have a whole happy hour with you all.
I have a question from Win Briscoe. So Win.
Can you all hear me?
No,
Yes.
hold on. This will be the last question.
Oh, no, it's no question. It was a reminder, Troy, thank you. It was a reminder that we have a upcoming business plan class on May 2nd. So those who were asking about questions and needing assistance, we will go over that in that class. It's May 2nd. You can find the information on the Small Business Development Center website. I will be teaching that class. Again, it's May 2nd and it's via Zoom. So that's www.sbdchelp.com. Thank you.
Is it free though?
It is not.
Can we get that I know Win Briscoe discount?
It's being taught via the College of Southern Maryland, so that's not possible. But reach out to me if you need assistance.
Roger that. All right.
Okay.
All right, Alibis. You have anything you want to say to the people there, Miss Dillahunt?
No, that's not it. That's it. I was gonna just check in with education and just make sure that if you have any questions about education, please visit your smcps.org or speak with your school principal. Stay in contact with your teachers and make sure all of your information is updated in the system, and you'll be able to contact the schools and be able to update information. If you're having trouble with access to internet or computer, there are packets that are being distributed. Bear with us. They are coming out, and just want to let you know that St. Mary's County Public Schools is doing an excellent job at considering, what's going on in this difficult time, at trying to close our gap in terms of, access to, materials and everything like that. So if you have any questions, please visit the smcps.org website.
All right. Dr. Walthour, did you have anything you wanted to say before we get off?
Just real quick, I know this was the last question, but because I'm on my phone, I could thank you, BJ. I heard Dr. Brewster talk about the contact tracing, and I was wondering about the positions available for that. Will there be enough people to do that? I've been listening to the news, and we're having testing issues, but really those people that will be helping to see who has the virus and do that legwork or paperwork. So that was one of my questions. And then just a comment about the 40 people that did have the virus here, the African-American population, and we only make up 14%. And I think that's at least 30. But I know that's something that we are all trying to put our heads together on, looking at issues that affect some of our minorities and low-income folks. So then my question was about the contact tracing positions available for that.
Great. Thank you so much, Dr. Walther. I think those are both great topics to talk about. And I'd love to have more conversation about that, especially the last part about health disparities and how we address health equity in our community. I think it's health equity is the foundation of public health in so many ways. And we need to be constantly monitoring where there may be disparities across different groups in our population when it comes to different kinds of health conditions. So maybe I'll just address that first since I'm talking about it. When it comes to the positive cases that we've seen, again, this is just a reflection of people who've been tested. right? As I said before, there's probably many more people out there who are not being tested, either because they don't identify as having symptoms and or don't kind of meet the need for testing, or they're just being recommended to stay home and treat their symptoms as if it was COVID-19. So this is a lot about who's being tested. And you're right, we would not expect, given the proportion in our population here in St. Mary's County of African-American residents, we would not expect as high a number as what we've been seeing in our positive lab test results, right, for individuals who identify as African-American. I think it's really, there's kind of two things here. Like I said before, the testing is just a portion of who may actually be sick or diagnosed with COVID-19. But we also have to delve into, well, why, if it truly is that more African-American residents are being impacted by this disease than expected based upon, portion in a population, then we really need to look into why, like what's driving that. And is it that, there's maybe less opportunity for social distancing? I don't know. I mean, these are the kind of questions we need to be asking. Are people working in essential businesses and not able to stay home? Are they, having more multi-generational families in a household or in their neighborhoods? I mean, these are the kinds of things that we ask when we start to see disparities coming up in a community, is not just what may be contributing to why people may be more represented in diagnosis, but then also looking at the severity of disease and are people getting less access to health care or those types of things, because that drives a lot of our next steps in public health. If once we identify disparities and we start investigating that and we try to figure out why is, the reasons for all of that, we need to act. We need to figure out what we as a community can do together to start addressing these disparities and to better promote health equity across our whole community and everyone who lives here. So I think that's a great topic. I love the topic of health equity. Would love to explore that more with anybody who really wants to talk more about that. Your first question, if you could remind me, because I've been talking for so long, I forgot the exact.
My question was just, with all of the trade testing that needs to happen, will there be jobs available for people that are interested in working with the health department on this contact tracing, where, if they have the disease, they have to trace and find out who went to Walmart, who went here, who went there. I mean, if that's something that's going to overwhelm the health department, are there positions available or jobs, or if volunteers wanted to be trained, is that something that's possible? I know we're trying to get off the line, but that was what it was about.
Yeah, I appreciate you bringing that up too. Thank you. Yeah, I mean, this is pretty intense and very long hours and pretty, significant work and important work to controlling and containing a pandemic and really any kind of outbreak investigation. We do need to expand our focus, not just for this pandemic, but for moving forward. I mean, this is changing our world in public health and also our world and how we handle infectious disease and pay attention to infectious diseases developing across the world, right? And understanding that there still may be local impact from those things. So yes, moving forward, we are going to have to take a different approach in making sure that our public health infrastructure is adequately prepared with the infectious disease investigation, contact tracing, monitoring, containment type approach. And so in the future, as we look towards reshaping how we are set up as a public health agency, that's definitely a conversation to be had with our commissioners and our Board of Health and our community is how can we as a public health agency better anticipate and address the disease investigation demands of this new world that's going to be coming out after this pandemic. Right now, based on what we're able to see and predict with this pandemic, we do expect this to go on for months. Maybe not like how we are right now, where we're anticipating a continuing rise in cases, where we're staying at home and so forth. But we do expect that we're going to be dealing with COVID-19 for many, many months. And until we have widespread vaccination, if that becomes available, months down the road, we're going to be doing a lot of disease investigation, contact tracing, and trying to contain the spread of disease before it gets to like where we have it now at pandemic levels. So there is a workforce issue that we will need to move forward with. Right now, we have the ability to repurpose individuals who are working within our health department. The commissioners have provided support already for our health department to bring on an additional nurse. And so that has really helped us for right now. But as we continue to see cases increase in this county, and as we start to return some portions of our department back to their normal functions, yes, we will be looking to bring on individuals to help us with disease investigation. I don't know the details of that yet. Some of that is going to depend upon, of course, funding and what the state's also doing in that regard. So we can partner with them and be efficient with how we use resources. But yes, absolutely. In the months ahead, we are looking to expand our disease investigation capacity. The disease investigation. I don't know the details
Dr.
of
Brewster.
that yet. Some of that is going to depend upon,
And I think we're done with our question and answer portion. I'm going to turn it back over to you, Mr. Hall, for any closing comments.
With how we use resources. But yes, absolutely. In the months ahead.
Oops, I muted you. Sorry.
Thank you. I appreciate it. I don't have much to say. Everybody, I think, has said everything that needed to be said. I appreciate everybody who came out to participate. And I look forward to this being a more regular occurrence. So thank you for coming out. Good night and God bless. Be safe out there. Adrian, you have to end it.